Let me tell you about my personal experience with the measles. I'm Dr. Irene Papakonstopoulos, a board-certified pediatrician in Hawaii and also in the European Union. And most doctors of my generation have not seen a case of measles. But in 2010, during my first residency at the University of Athens, Greece, with my colleagues, we saw some cases of measles. Measles is an RNA virus that is transmitted from person to person by droplets that are airborne or with direct contact. The incubation period is 7 to 21 days, so usually 10 to 12 days after being exposed, a person will start having symptoms, and 14 days after being exposed, they may present with a typical rash. The virus can stay in the environment that the infected person was for up to 2 hours after that person has left the area. And 90% of people that do not have antibodies against the measles will get it if exposed in these prior ways. Now, a person who has measles is transmitting 4 days before they have the rash and until 4 days after they get the rash. And the first symptoms can be high fever and then the 3 C's. Cough, conjunctivitis, and coryza, that is a runny nose. So it looks initially like most viral illnesses. Then a rash may present starting from the top of the head and behind the ears and will spread all the way down the whole body at the same time as the patient still has a high fever, which can reach 104 or 105 Fahrenheit. And this typical rash presents at the same time with the fever, and that helps differentiate it from other viral rashes. One thing that is unique for measles are Koplik spots. These are typical white-looking spots in the inside of the cheeks, but they present in the very first days of the illness and then they disappear. So although they are pathognomonic for measles, many times they're missed. Finally, the best person to tell you how to prevent the measles is your pediatrician and your personal doctor.